Welcome to our new webinar series exclusively developed for our generous donors. Thank you so much for joining us. I'm Jane Adams, President and CEO of Surrey Hospitals Foundation and your host for today's webinar. Surrey Hospitals Foundation is proud to support our region's major healthcare facilities, Surrey Memorial Hospital and the Jim Pattison Outpatient Care and Surgery Centre. We also raise funds for the Chorney Alzheimer's Centre and dozens of other programs that support our region's residents from birth until end of life. In the near future, we will be raising funds for the new hospital that is scheduled to be built in the Cloverdale neighbourhood of Surrey. Yes, a new hospital. It's a very exciting time for healthcare in Surrey. If you've received care at one of our facilities, then you know we have an incredible team of professionals here, from physicians to nurses, technicians, admin, and a variety of specialists. Our webinar series allows us to introduce you to some of our very talented healthcare team. Today's presenter is Dr. Kirsten Grabowska. Dr. Grabowska is a maternal fetal medicine specialist who joined Fraser Health in 2012. A specialist in maternal fetal medicine is an obstetrician who has additional training in fetal diagnosis and the management of high-risk pregnancies. After completing her residency in obstetrics and gynecology at UBC, Dr. Grabowska spent 2 years working as a locum OB in BC and the Northwest Territories before pursuing her fellowship in maternal fetal medicine in Calgary. Since starting her practice in Fraser Health, Dr. Grabowska has developed a niche interest in managing medically complex pregnancies. Dr. Grabowska, welcome.
Thank you, Jane, for your kind introduction, and thank you also to the Foundation for hosting me as a part of the webinar series. I am Kirsten Grabowska, and I'm one of the maternal fetal medicine specialists here in Fraser Health. I work at both Surrey Memorial Hospital and the Jim Pattison Outpatient Centre. When non-medical people ask me what I do for a living, I tell them that I'm the person you hope you don't meet when you're pregnant, either because you've been diagnosed yourself with a serious medical condition, or you're healthy and you went for your routine ultrasound and the radiologists have discovered something abnormal with the baby, and so then you come to me for additional fetal diagnosis. So that's the work that I do. In some cases, both mums and babies are sick, and the COVID-19 infection in pregnancy is just one such case. So I thought it would be timely to reflect on how we've been caring for the very sick mothers with COVID-19 illness in pregnancy here in Surrey, to let you know where we are, and also share with you how the hospital has developed even in the last decade and where we're going in the future. 1 year ago today, this was the cover of the Globe and Mail, one of Canada's national papers. And here in BC, we had recorded our first death from COVID-19. And I think for any of us reflecting on what we've been through in the last year, it would be difficult to predict how we've changed our personal and professional lives. Certainly, I couldn't have predicted all of the changes that I've seen in my own practice. So where are we today? Okay, not quite today, this was last night. I went on the internet and used the database I most commonly use to search medical literature. I'm of course dating myself because I think young kids these days would probably use Google or Snapchat, but I was on PubMed. And I put in the search terms COVID-19 and pregnancy, and I got more than 2,000 hits. That's astounding. That's our understanding of the management of pregnancy with women with COVID-19 in just 1 year. It's difficult to keep up. So we're going to talk a little bit about the implications of COVID-19 infection in pregnancy, and then discuss the specialized teams and infrastructure that we need to care for the very sickest of our mothers, and then talk about what we've learned from this and where we as a hospital are moving in the future. So just about a year ago, March 24th, 2020, a group in China from Wuhan published the very first series of pregnancies with COVID-19 infection. And this, by the way, was a major landmark study, which you don't normally say about a study with only 7 patients. But that's what they had, and it was the beginning. So it was a retrospective study of 7 women with COVID-19 infection. And they were all close to term or close to their due date. And they all did very well. None of them needed to go to the intensive care unit, and all of the mothers and babies had good outcomes. They had 1 infant who tested positive for COVID-19 infection, but the placenta and the cord blood were negative, so they didn't think that it was a true vertical infection, rather that maybe the baby caught the infection from the mother after delivery. So this was our initial understanding, and I'll share with you all that this was the information that I shared with my patients until approximately October of last year. I was encouraging that it did not seem that COVID-19 was an infection like H1N1, in that it did not seem that pregnancy put an individual at increased risk of a worse outcome. However, in the fall, as we got more and more data from the growing pandemic in the United States, in the United Kingdom, in Spain, we learned that in fact pregnant women are at higher risk. That approximately 10% of our pregnant women with COVID-19 infection will need to come and stay in the hospital. That's compared to approximately 5% in the BC population, so double the risk of needing hospitalization. And that approximately 2 to 4% of pregnant women with COVID-19 infection will need the services of an intensive care unit. So that's about a 1.5-fold increase in risk compared to non-pregnant women of reproductive age who have the infection. So this was indeed sobering for all of us. We've subsequently come to learn that in addition to causing increased risk for the mother, COVID-19 infection in pregnancy increases the risk for the babies. There's a 3-fold increased risk in being born early, and that also translates to a 3-fold increased risk in needing the care of the neonatal intensive care unit. There's also an increased risk that the mother will lose the baby, either by stillbirth or neonatal death. And now that we have more robust data, we're quite reassuring that the risk that the baby will catch COVID-19 infection from the mother is low, but it's not 0. It's about 3%. So to review where we are right now as I stand here today on March 9th, 2021, I can reassure my pregnant women that most of them, if they have COVID-19 infection, will experience mild illness. But I also have to caution my patients that pregnant women are at relatively higher risk of severe disease. And that has implications for how our patients live their lives, for how careful they've had to be through this pandemic. I also have to be mindful myself when I have a pregnant woman with COVID-19 of the risk of adverse pregnancy outcome, of the risk of premature delivery, pregnancy loss, and the risk that the neonate could also have the infection. So, taking a moment to breathe, I'd now like to share with you how we in Surrey Memorial Hospital have been managing our very sickest mums with COVID-19 illness. And I want to use the African saying made famous by Hillary Clinton, which is that it takes a village to raise a child. I have to tell you that the care of a critically ill pregnant woman with COVID-19 is not something any one individual can manage on their own. The journey of a pregnant woman with COVID-19 illness in Surrey Memorial Hospital starts either in the emergency department, or if the patient is transferred by medevac, often by air from another center, directly to the intensive care unit. And in the intensive care unit, she will receive the expert care of our intensive care physicians and nurses, the respiratory therapists who help to manage her respiratory illness, as well as physiotherapists who help to reduce the risk of secondary comorbidities such as blood clots in the legs, and also pharmacy who assist with making difficult decisions about medications for these women. As the woman recovers from her most critical illness, she will then be transferred to the medical wards where there's similar medical care. All the while, the woman's care is supported by our obstetric service, and she will be met by our team of obstetricians who will be available 24/7 to do an emergency delivery if that is required. Our expert obstetrical nurses who participate in fetal monitoring daily for these women to ensure that the fetus is safe during the mother's critical illness. And our perinatal pharmacy team who are expert in managing the risks of drugs in pregnancy. Our care is supported by our entire neonatal intensive care unit, the team of neonatologists, neonatal nurses, pharmacists, and social workers. And I really would like to highlight our social work team who throughout our hospital will work with the families as women transition from one unit to the next, from the intensive care unit to our labor and delivery suite, to supporting the family through the stress and trauma that a neonatal intensive care admission can be, and then helping them transition back to their home environments. So you can see that caring for these pregnancies requires high-level care from so very many dedicated experts and carers. If you build it, they will come. So what's now happening in Surrey Memorial Hospital is that we have become not only a tertiary referral center for pregnant women with critical illness here in the Fraser Valley, but we've become a provincial referral center for these complicated pregnancies. And women are now being transferred from around the province to Surrey Memorial Hospital for the specialized multidisciplinary care that we are able to provide. We all know, believe, and hope so desperately that this panic will end soon. But what's not going to change is the reputation that Surrey Memorial has built during this difficult time. And what we must now do is focusing on continuing to build our infrastructure to support the most complex cases of tomorrow. So I thought I'd remind us all a little bit about where we've been and where we are before I talk about where we should go. And so when I started a decade ago, Surrey Memorial Hospital was doing approximately 4,000 deliveries a year. Our neonatal intensive care unit was in transition, so we weren't able to care for the very earliest of babies. We had a single obstetrician on call who had access to a single operating room and who did not have dedicated obstetric anesthesia services. And there was one full-time individual doing the work that I do. Cut to a decade later, and look where we are. So we're doing almost 1,000 more deliveries per year. But the significant investment in infrastructure and personnel has enabled us to transition not just our volume, but to a full tertiary referral center where we can care for the most complicated pregnancies. We now have the second largest neonatal intensive care unit in the province, and we can care for pregnancies at the very threshold of viability. We have 2 obstetricians on call, 2 dedicated obstetric operating rooms, and dedicated obstetric anesthesia supporting this work. And now there are 6 of us. We're multiplying like rabbits, I guess you could say, doing high-risk maternal fetal medicine care. So what are the changes that you might notice with some of our infrastructure? So what our patients love and appreciate with our wonderful new ultrasound technology is our ability to do 4D ultrasound. And this is a 4D ultrasound image of a fetal face. It's not actually diagnostic, and I don't actually need this for making clinical decisions. But I want to tell you that when you have a mom who's critically ill in the ICU and she's not sure if she's going to get to hold and see her baby, showing her this image is incredibly, incredibly powerful. So this is one of the big advancements of our technology. Now I'm going to show you something that I don't expect you to be able to interpret. At least I certainly hope that you can't, because then I look like a fool for needing 7 years to learn how to do this myself. But what I'm showing you is why we really, really needed advanced ultrasound technology. And this graphic depicts blood flow studies of a tiny little vessel called the ductus venosus. I'd encourage you to think of it as the fetal lifeline. And we interpret flow patterns in this vessel to tell us about the oxygen status of the baby. And it is the definitive assessment for deciding if a sick baby should come out, even if it's very, very early. But it's really hard to see. It's tiny. It's the size of this little white part of my fingernail. I don't know if you can see that. It's minuscule. And when I first started in Surrey, we had this old clunker of an ultrasound machine. I could never find this vessel. But now, with our improved technology, I can find it every time. And I use this every day, making decisions in the very sickest of pregnancies. In addition to adding infrastructure and technology, we've added personnel. And personnel, I want to share with you, really matters. So this is hot off the press. This is a letter to the editor from one of the major journals in my field, in obstetrics and gynecology, written by one of our intensive care physicians, Dr. Mitra, and our pharmacist, Dr. Hilary Rowe, accompanied by the neonatal pharmacist and one of our obstetricians, Dr. Johnson. And they were questioning national guidelines from the United States in the use of steroids in reducing the risk of mortality for the very sickest of pregnant mothers. And I will share with you that subsequent to this publication, there has been an international shift in how we think and approach the use of steroids for reducing the risk of mortality in moms with COVID-19 illness. So it's not just the building and it's not just the equipment, but it's the people that allow us to do the work that we do. So what have we learned? We've learned, myself personally and professionally through all of this, how important it is to have an open mind. I think we can all appreciate the changes in public health advice, for example, with masks as we've gone through this. And so I would encourage you to imagine what that's like for medical care providers, that we do need to continue to reevaluate the information as it comes and change our practice and be flexible and fluid. And that's been easier for some of us than for others. We've learned the value of having an inquisitive mind, of evaluating the evidence as it comes and international guidelines, and really questioning them and applying our knowledge of our own local population to this management. And finally, we've learned a little bit about the implications of being a provincial center of excellence. We're at risk of becoming victims of our own success. But I will say that Surrey here, our community, our home, has an astounding ability to welcome outsiders from all over the world. We're now welcoming families in crisis, and so as we move forward as an academic center of excellence, we should think of ways to improve the care for the whole family. COVID-19 won't be here forever. Oh, please, it won't be here forever. And that's going to change. But our ability to care for the most complicated pregnancies, that's not something we're going to need to stop doing. Surrey Memorial has now solidified a reputation in this province as a center of excellence for caring for the most complex pregnancies, and we are developing a reputation for leadership nationally and internationally. We must not rest on our laurels. We must take the lessons we've learned through this pandemic and use them to propel our center to the leader in perinatal care that we always knew it should be. So with that, I will leave you with this image of a mother and baby, and thank you so much for your kind time and attention. It was a pleasure to be asked to come and chat with you today. Thank you.
Thank you so much to Dr. Kirsten Grabowska. The maternity unit was one of the first units to open at Surrey Memorial Hospital, and as you have heard, it has evolved into an important provincial centre for caring for complex cases for mothers and babies. We have outstanding women's health professionals and facilities here in Surrey, and are so lucky that specialists such as Dr. Grabowska choose to call Surrey home. Viewers, I hope you have enjoyed your time with us today. Your ongoing support is so appreciated. Life-changing nursing healthcare is constantly evolving in Surrey because of you. We ask that you kindly take this brief survey to share your thoughts on today's presentation. It will take less than 5 minutes and is very helpful for us moving forward. You'll see a QR code come up on the screen in just a moment. You can scan it easily with your phone's camera or just click on the link below this presentation. As always, we love to hear from you. If you want to discuss this webinar or have any other questions or concerns, please reach out to us at 604-588-3371 or visit us anytime online at surreyhospitalsfoundation.com. Thank you again for joining us. We hope to see you at our next event.